Hello guys, welcome back. Today we will discuss about other psychiatric topic, that is electroconvulsive therapy. It is one of the treatment modality which is using in psychiatry to treat some severe or extreme stages of some psychiatric condition like mania and depression. So before going to the topic, I'll give you some information. This PPT is only some general informations. This is not an advice. If you want to take ECT or someone related to is going to take ECT, means you must get proper enough official professional specialist advice. That is very important. So what is ECT? ECT means electroconvulsive therapy. Electroconvulsive therapy or ECT is a treatment which involves sending or passing an electric current through the brain and creating seizures or electrical activity in the brain. So passing current into your brain and creating some seizures or electrical activity to stop the abnormal activities of the brain means that is known as ECT or electroconvulsive therapy. Is it always given under general anesthetic agent and muscle relaxant agent, and ECT is not used for children under the age of 11. So in which are all the condition basically we will give ECT means ECT we will give in the condition like severe depression, catatonia, that means stone-like situation without any movement the patient is sitting, and severe mania. So severe depression, severe mania, severe catatonia. In this severe stage only we will go for ECT. In severe depression the patients will try for suicide. In severe mania the patient cannot stop and it's unstoppable, and catatonia the patient will be in the stone-like situation without any movements. In these situations, to make the patient to come back to the normal life, most probably the psychiatrist or the person who is giving treatment to the patient will suggest for ECT, but we have to get the informed consent from the patient. That is very important. Without their consent we cannot go for ECT. And how much current is passing to the brain and how much time means 60 to 120 volt of current for 0.7 to 1.5 second. 60 to 120 volt of current for 0.7 to 1.5 second is administering to the brain. And there are two types of ECT we have. They are bilateral ECT and unilateral ECT. In this picture you can see what is bilateral and what is unilateral. Bi means what? Bi means two. So in bilateral, in both side of your lobes, timbers, that means in both side of your head the electrodes will place. In unilateral, only one side of your brain major electrode will place and one will be in the non-dominant hemisphere. Okay, so that is the two types of ECT, bilateral and unilateral ECT. In bilateral ECT, in two sides of your head the lobes will place or the electrode will place, and in this case what will happen, the whole brain will get stimulated. In unilateral ECT, one side of your brain will get stimulated because the two electrodes will keeping in one side of your brain. Okay, so there are two types of ECT, again unilateral and bilateral. So here we can see the electrode placement position. Each electrode is placed 2.5 centimeter to 4 centimeter on the midpoint on a line joining the tragus of the ear and the outer canthus of the eye. In this picture here clearly you can see where is the tragus of the ear and where is the outer canthus of the eye. So they are drawing an imaginary line between the tragus of the ear, that means the outer part of the ear, and outer canthus of the eye, that means the outer corner of the eye. So in between that they will draw an imaginary line. After that the electrode is placed 2.5 centimeter to 4 centimeter on the midpoint on a line joining the tragus of the ear and the outer canthus of the ear. In unilateral ECT, in one side they will keep the electrode, and in bilateral ECT in two sides they will keep the electrode. So while coming to the pathophysiology, what is the exact pathophysiology? That means the mechanism of action behind this process is unknown, but there are some theories to explain the pathophysiology, but 100% proof we don't have for these theories. The theories include neurotransmitter theory, endocrine theory, psychological theory, and anti-convulsion theory. Neurotransmitter theory says that ECT work like antidepressants and change the way the brain receptors receive mood-related chemicals. So it behave like antidepressant, it act like antidepressant and regulate the mood by releasing some chemicals. Second theory is anti-convulsion theory. Anti-convulsion theory says that ECT-induced seizures teach the brain to resist the seizures, and this activity will helps to stop the abnormal functioning of the brain. So ECT-induced seizures will teach our brain to stop the abnormal seizures. The neuroendocrine theory is saying that when ECT-induced seizures are developing in the brain, that will helps to regulate or helps to relieve a hormone or a chemical called neuropeptide, which is helpful for regulating the mood. But these theories don't have 100% proof to explain this is the mechanism of action. So in conclusion, we can say that the exact pathophysiology or the mechanism of action of ECT process is unknown. Now we will see the ECT clinic structure. There are three rooms we can see in ECT clinic. They are waiting room, a treatment room and recovery room. Waiting room means the room where the patient will get relaxed and will get all the information, and also will get the informed consent from the patient, and we will make the patient to get ready for the procedure from the waiting area. Then treatment room, from the treatment room the patient will get ECT, and after that the patient will go to recovery room to come back to the normal life. And you need to be an inpatient before going to get ECT. That is very important. Suddenly going to the hospital and taking ECT is not a possible thing. You need to get admission in the hospital. You need to undergo proper thorough assessment checkup, and this is the end stage of treatment. For extreme stage only the doctor will suggest ECT, so you need to be an inpatient before going to get ECT. Then preparations and procedure for ECT. So there are a lot of preparations and procedure, and nurses are playing a major role in this area. We always need to wear loose clothing, that is comfortable clothing, because there are chances of fall, movement and kind of things. Then remove all jewelries and cosmetic, dentistry, implants, etc., because passing current. Then should not eat or drink anything except a few sip of water for at least 6 hours before treatment, because we need to give anesthesia and muscle relaxant. Then after preparing these things, the doctor will administer general anesthesia. After anesthesia will give muscle relaxant, because chances of contractions and other kind of things are there in the body. Then followed by that we'll administer oxygen. Then after that will place the electrodes on the two sides of the head or one side of the head, depend upon the doctor's prescription. Then place a mouth guard to prevent the tongue. Always will keep a mouth guard in the mouth to prevent tongue biting, because when the current is passing, the body will start to jerk, and chances of injury and tongue bite is most common thing in ECT. So to prevent that tongue bite, will place a mouth guard in the mouth to prevent the tongue bite. Then after doing all these things, we'll pass the electric current. That means 70 to 120 volt or 60 to 120 volt of current for 0.7 to 1.5 seconds. Then after ECT procedure, the mouth guard is removed and will be turned on the patient's on-side. That is very important. Then the anesthetic will provide oxygen for few more minutes until you start breathing neuron. Then we will wait for some more time to get relief from anesthesia and muscle relaxant effect, because the effect will be more. Then the very important point, ECT is usually given twice a week for 3 to 6 weeks. That means 6 to 12 sessions. And after each ECT section, the doctor will do a thorough assessment to check the status of the patient, as well as to stop or continue the ECT. While coming to the side effects, there will be long-lasting side effect and short-term side effect or immediate side effect. Long-lasting side effect include memory loss and some fractures. Okay, long-lasting side effect means it will continue for a long time. Sometimes the patient cannot come back to the normal level. Among that, first and foremost thing is memory loss. Due to passing current into the brain, there are chances of damage your nerve cells, and that may lead to memory loss. And the immediate side effect include confusion, headache, feeling sick, drowsiness, injury, etc. And this side effect will go off after some time. Next is nurses' role. Nurses is playing a major role in the treatment modality, especially during and after and before giving ECT. Nurses is the one who can provide psychological support to the patient. They are providing education and emotional support, pre-treatment assessment, preparing and monitoring the patient, explain the procedures to the patient, obtain an informed consent from the patient, respond to patient's concern because they have a lot of questions, then complete the pre-treatment checklist, remove all jewelries and make them to wear loose clothes and make them to comfortable, and a very important thing, minimize their anxiety. So this is the nurse's role, and after doing all these things we can go for ECT. So this is about ECT. So ECT is one of the treatment modality which is using in psychiatry to prevent severe complications of some conditions like severe depression, severe mania, and the severe catatonia. Hope you understand, guys. Thank you.